It was a change in how I saw the relationships with people who matter in my world. And it was a realisation that the people who loved me and cared about me thought that there was something seriously wrong and they were trying to help me. Now, I threw that back in their faces. I told them I was fine. They didn't know what they were talking about. And then one day I realised that I saw it on the faces of my siblings. They were so concerned about me. I saw it on their faces that they didn't know what to do. They wanted to reach out to me, but they couldn't get a hold of me because I was somewhere else. And I realised then that I was going to lose the things that really mattered to me.
So, Suzanne, thank you very much for joining us at Just Mental Talk, our podcast. Tell us a little bit about yourself.
Well, thanks for inviting me. I'm delighted to be here. Well, my story is quite straightforward. Not. I have a diagnosis of bipolar disorder, which was given to me 18 years ago by a psychiatrist in Dublin. I was living in Dublin at the time and working there. And I also was a single parent of an 18-month-old boy. So for about a year, things hadn't been right with me. My GP kept telling me I had depression and treating me for depression. But I had depression many times in the past, and I knew that something wasn't quite right. So eventually I got a referral to a psychiatrist, and on the day she saw me, she spent 2 hours with me, and then she asked me to pack a bag, go home, pack a bag, you're going into hospital this evening. And that was me in hospital for 2 months.
Mm-hmm.
That was obviously a huge break in my life, and I do sort of think of things as before and after that time. Getting the diagnosis was a relief to me because the psychiatrist was able to explain to me a number of things that totally fitted with my behaviour over a period of time. Things like not sleeping, staying up till 3 a.m. Because I was, so excited and either writing things in a book or watching TV and then getting up again at 6 and doing the whole getting the child ready for creche and then going to my job, which was a very demanding senior position, working in marketing and communications. And nobody could have kept up the sort of lifestyle that I had. I just wanted to be at the centre of things all the time, and I was impatient, I was irritable, but I thought I was doing all these important things, so, nobody could stop me. And I wouldn't stop and listen to advice from people, except the psychiatrist, because I trusted her, and she was so helpful and supportive. So I had 2 months in hospital to reflect on my life, and I decided I was going to have to make some serious changes. So first of all, I decided to relocate back to Belfast instead of banging my head off the wall in Dublin, trying to create a whole new life for myself, which was just too much. And that I had to spend more time with my family who cared so much about me and who had been so worried about me, because they had noted my behaviour and they didn't know what to do about it. And I did some really difficult, mad things. I wouldn't listen to them. I thought that they were just against me. And all they were doing was trying to keep me safe because they knew that, things weren't right. So I decided to take a step back from my marketing career. It was too much stress and pressure. And I realised that my job didn't define me as an individual, that, there was life beyond a career. So I had a few years where I didn't work. I was a full-time mother. And then I started to become interested again in the idea of helping people. I wasn't sure where to start, but I bumped into a woman called Helen Anderson at a course. And at the time, she was the boss in the Belfast Recovery College. And she told me about the Recovery College and she told me about peer support work. So off I trotted to the Belfast Recovery College, which I have to say changed my life. The people in there, so helpful, so encouraging, all of them with their own diagnosis of mental illness in their past. And there was no hiding anything. There was no decision whether to disclose or not disclose that I had a mental health condition. Everybody was just treated equally. So I did their courses. They had courses with titles like How to Live with Bipolar Disorder, How to Deal with Anxiety and Depression, How to Improve Your Self-Esteem. Courses that anybody could attend, and they're free to anybody over the age of, I think it's 16. And I did all the courses I could possibly do, and then I was told that there were peer support jobs about to be advertised. So at that time they were advertising a number of peer support jobs. I think it might have been as many as 10. So I applied, I was successful, and I was offered the peer support role within a team called the Home Treatment Team at the Belfast Trust. That is a brilliant team to work for. It's demanding, it's fast paced, it changes from one day to the next, but it's never boring. And I go to see people in their homes who are dealing with mental illness. Sometimes they've come out of hospital, sometimes they might be waiting to go into hospital, but they all have something in common, which is they've been diagnosed with some aspect of mental illness. And I just strike up a conversation with them. I ask them if they're interested in peer support, and I explain what it is, because a lot of people haven't heard of it before. And it all boils down to them trusting me that I can do something to help them, and showing them that being hopeful and optimistic about the future is the right way to go, even when things seem very dark. And for a lot of people, they have been in the dark for a long time before I get to see them. They might have been undiagnosed, like I was for a year, but they might have been undiagnosed for years or misdiagnosed, but they've eventually arrived in the right place at the right time to get a proper diagnosis and a treatment plan. And I'm part of that treatment plan. And it is a privilege to talk to people, mostly actually to listen to them, especially in their own homes where they feel most comfortable. And they open up. I would say out of all the people I see, and in the last 6.5 years, I've seen hundreds and hundreds of people, 95% of them will agree to peer support. That is on the basis that they've got an open mind about who can help them and what sort of help they need. I tell them about certain things like the Recovery College. I will point them in the right direction for other support groups. It could be Aware, it could be Cause, it could be any number of organisations working in the field, and they usually are open to taking any kind of help that they think will make an improvement to their lives. And some people have been through trauma and depression that they're not even aware of the impact it's had on their lives, and they're only starting to become aware that they have to recover from it. So peer support is a really important part of the recovery process, and that's something that I try and get across to people. No matter what you've been through, there is support out there, and people do want the best for you. People want to help you get better and to stay better. There's absolutely no reason why, even though you've been through some extreme situation, that the rest of your life can't be better than that, because it can be. You might have to manage a mental health situation, because the idea that people get cured that's just a pipe dream. Some of us won't get cured, so we have to learn how to manage our mental health condition. We have to know who else we can trust to help us through that process. I think that we have to have an open mind about where the help can come from. Because nowadays it's not just the health system, it's voluntary and community organisations, some of whom are doing amazing work for people. And also what I find is that people are afraid of failure. They're afraid of what people might say about them behind their backs if people were to find out that they had a mental health diagnosis. But those are things that you have to park if you really want to get better. And the reason for that is that you can't let other people drag you down. That you have to look inside yourself and say, what do I want from life? What will make me happy and healthy for the rest of my life? Because we all have possibly years of happiness ahead of us, but we just have to get through this really difficult set of circumstances that we're going through at the moment.
And Suzanne, you mentioned bipolar. You were diagnosed with bipolar. When you got the diagnosis, did you know what bipolar was? And do you now understand what it is?
Yeah, that's a good question. I thought I knew what bipolar was because you hear people bandying that term around, saying like, "Oh, so and so's a bit bipolar," almost in a slang way.
Yeah.
But bipolar, what it is not, is one day you feel high and the next day you feel low. Much more likely that you feel low or depressed for a long time. Could be months, could be years, depending on if you get diagnosed. And then when you're up and you're high, that also can last for months or years if not diagnosed properly. So that was the big learning for me, was that low moods and high moods can last a long time.
Okay.
And this low mood, people tend to stay at home, withdraw, and, suffer their pain in silence. High mood, you want to be out, you want to be with people, you want to be on the go all the time, you want to stay up, like I said, all hours, you want to have a glittering social life. None of those things are sustainable.
Yeah.
And the sooner that you meet helpful people who can tell you what to expect, the sooner you'll be able to recover. Otherwise, you keep making the same mistakes you've made before.
And what did your bipolar look like?
Oh,
You've described generically what it might look like.
Yeah.
What did yours look like?
I would have been described as hyper.
Okay.
Or manic. Because bipolar, the previous description of it was manic depression.
Right, okay. So it's evolved now from manic depression to bipolar.
Exactly.
Right, okay.
And bipolar disorder is a much better description than manic depression. But yeah, episodes of mania were, again, not sleeping, not eating, not looking after myself, thinking that, I was spending money irrationally, overspending. What else? Just not sitting down and smelling the roses, not being able to reflect that life is good because you're always trying to get somewhere else, trying to do something impressive, just trying to be something you're not all the time. And underneath that, the feelings are that you have no self-esteem. And that's why you try so hard to be these things that you're not really. And you really need a lot of careful help along the way to teach yourself how to build up your self-esteem and your self-confidence and the feeling that you have something to contribute to the world, and you don't have to run around trying to be something you're not all the time.
And you said pre your diagnosis, you knew there was something not right, that you didn't feel right. What was it that sort of clicked with you to say, do you know what? There's something wrong here. What made you click? What was it that made you click?
It was a change in how I saw the relationships with people who matter in my world. And it was a realisation that the people who loved me and cared about me thought that there was something seriously wrong and they were trying to help me. Now, I threw that back in their faces. I told them I was fine. They didn't know what they were talking about. And then one day I realised that I saw it on the faces of my siblings I have 3 brothers and a sister, and they were so concerned about me. I saw it on their faces that they didn't know what to do. They wanted to reach out to me, but they couldn't get a hold of me because I was somewhere else. And I realised then that I was going to lose the things that really mattered to me because I hadn't lost my moral values along the way. I just had ignored them.
Right, okay.
And it was seeing that pain in other people's faces that jogged my mind. And at that point, I realised I was going to have to get help no matter how long it took, no matter how difficult it was to plug myself into a system that could help me, that those were things I was going to have to work through, and I was going to have to do the very difficult things.
Okay.
And that's what I started to do.
It must have been incredibly difficult. You said your diagnosis came in roughly around when your son was 18 months. So to be a single mum with an 18-month-old child and be diagnosed or not diagnosed, but know that there's something not just quite right, that must have been incredibly, incredibly difficult.
Feeling like you're a bad parent is one of the worst feelings you can have. And I've heard that from hundreds of people while I've been a peer support worker. For me personally, I was 39 when my son was born. So I had left it quite late. And part of it was I didn't think I was good enough to be a mother. And then when he was born and I became ill, and I should say it wasn't postnatal depression, it was bipolar.
Did you recognise that, though, that wasn't postnatal depression, or is it only looking back on it now you know that wasn't postnatal depression?
It's looking back on it.
Right, okay.
Yeah, exactly. So I had always felt that I wasn't good enough to be a mother. And then I became a mother and I absolutely loved being a mother. But I didn't trust myself to be a good parent. And I was lucky that I had other people close to me. My mother was still alive at the time. My sister, she helped me in a way I'll never be able to repay. She was there for me. She looked after my son for months. She just took him in and treated him like her own. Without that, I don't know where I'd be. But I valued being a parent so much, and I was so worried that I would get it wrong. And I did get it wrong. But sometimes you have to say to yourself, what is the worst that could happen? When there's something you're really afraid of, and you're so afraid that your behaviour changes because you're trying to avoid this thing that you're afraid of. And you have to say to yourself, what's the worst that could happen? And the worst that could have happened to me is that somebody would have taken my child away.
And do you think that feeling of someone taking your child away, do you think the way the system works, I don't know if it worked the same back then, but certainly now, there's a fear maybe in some parents and mothers or fathers that if they say certain things, oh, social service is going to be involved or someone might take my child away. Do you think that stops people from also opening up about their mental health?
Yes.
Yeah.
I do think it does. But what I would say is I know so much more about social work now than I would have done back then. Social workers work for a reason, and they prioritise the well-being of the child. And so what really in the course of a child's life, if they have to be looked after by social services for some weeks or months or years, like, isn't it better that they do that and that there is that community support? I think it's become less stigmatized than it used to be. But yeah, people who think, oh, the social workers are going to walk in here and take my children, of course that's going to stop them from asking for help. But asking for help is the first step to recovery. It is in lots of different areas of life, but particularly with your mental health. If you're not prepared to ask for help, then you can't expect people to read your mind.
Yeah. And you talk about support, and you mentioned your family support, and your family were incredible. Um, uh, there's a lot of people who don't have that family network or family support, or indeed sometimes a friend support network. Without that support, Suzanne, that you had, do you think your story might have been very different?
Yes. I know I was really lucky. As well as my siblings, I had several really good friends who just accepted it when I told them that I had a diagnosis. I don't think they were very surprised.
And this was also a time too when mental health still wasn't really being. There was still still a huge stigma around mental health as well.
Noticeably more stigma then than there is now. Like I would say, just to sort of generalize that, the acceptance of mental health nowadays in 2025 reflects the fact that the statistics tell us 1 in 4 people will experience mental ill health in the course of their lives. So you could literally walk into any house on this street, and I can guarantee you that someone there will have experienced mental ill health. They might be going through something now that they haven't even made sense of or asked for help for. But it's becoming much more acceptable to tell people. And I sometimes, if I meet somebody for the first time, I'm not, the first thing not going to say is, "Oh, by the way, I've got a diagnosis of bipolar disorder." Isn't that interesting? But if you're talking to somebody in a conversation and they say they're very worried about so and so, I'll always say, "Have you thought of getting some advice about that?" Because again, what's the worst that can happen?
And you talk about, have you ever sought advice about that? That leads on to a very good question. Where do people go to for that advice? If someone's really worried about someone, or someone themselves worried about themselves, and know that, as you said, that you just didn't feel something was right, where do people go?
First place to go, I know now, is your GP. GPs are very well informed about mental illness these days, and they will, if they're very concerned, they will make a referral straight away. I mean, if it's an extreme situation, you go to accident and emergency. I mean, if, for example, you're having suicidal feelings, and if you start to plan, oh, I wonder how I would do it if I do it. If you're at that stage, you go to A&E. Now, whether you go to your GP or A&E, you should end up in front of a psychiatrist as quickly as possible. And we have some fantastic psychiatrists in Northern Ireland. I don't know if we just breed a better class of psychiatry, but there's a lot of really good ones. You might end up with the home treatment team, and our job is to look after you at home. But you might need a hospital as well. That's always a possibility. Like I did. I was in hospital for 2 months, which sounds like a long time, but I needed it. So you might have to go to hospital. Well, there's a big hospital at the city called AMIC, the Acute Mental Health Inpatient Centre. They have 80 beds, and they're always full. You might need to go there. You might need to wait for a bed, but if you need that kind of treatment, you have to accept that that's the treatment you need.
And you were in a hospital for 2 months, Suzanne. What, for someone, and I appreciate everyone's story is unique. It's just that everyone's stories cross over at some point, and there's a commonality in everyone's story. But what does treatment for someone with bipolar look like, or what did your treatment personally look like?
Well, after hospital, then I was plugged into the health system in Belfast again, because the health system in Dublin is different, of course. But my experience there was extremely good. So I would have been passed on to a key worker, connected with my local community mental health team.
Key worker, now for people who don't know, key worker, is that the old, what they used to call CPN, or community psychiatric nurse?
Yeah.
Yeah, okay.
Yeah. And I was also able to see a psychiatrist. At that stage, it was on a regular basis, maybe once every 3 months. Nowadays, it's once every 6 months. I would also have had blood tests done because the kind of medication that I was given is called Lithium. Lithium is considered to be the gold standard of treatment for bipolar disorder. It's not for everybody. For people, most people report really good results on it. So I've been taking it for 18 years.
That's a tablet?
It's a tablet.
And what does that do? Is it about trying to sort of balance the chemicals within your brain?
Exactly. It's a mood stabilizer.
Okay.
So what it enables me to do is to have what you might call a normal life. So I can function, I'm doing a permanent full-time job within the Belfast Trust. I have a personal life, a family life that I value. I'm able to keep up with friends. I'm able to keep in touch with people. And even if I do feel that I'm having a wobble, or if I feel that my mood is dipped, then I can get directly in touch with my psychiatrist and ask for an emergency appointment. So I know that support system is there. It doesn't always work perfectly. Depending on resources, I sometimes have to wait longer for an appointment. But overall, the system does work, and that is a message that I would like people to take away, because thinking that the system doesn't work will keep you at home in your dark place, worried about everything. Being able to pick up the phone to your GP and say, I'm worried about depression, I'm worried about my mood, I'm thinking of harming myself or harming somebody else. Being able to do that, it'll change your life.
And saying those things, Suzanne, too, I mean, people who go to any or the GP, the most difficult step for some is, oh, I'm not going to any or my GP, but I'm going to sound silly by saying, oh, and there's people worse off. We hear this all the time, there's people worse off, there's people with cancer, there's people with leukemia, there's people suffering heart attacks, etc., etc., etc. So it's incredibly difficult sometimes, I think, for a lot of people who are suffering mental health to acknowledge the fact that their own suffering is just as bad as somebody else's, and the difficulty of taking that first step to ask for help.
We are individual human beings. We have a physical side and we have a mental side. If your physical side lets you down, you don't think twice about going to your GP. If you need specialist treatment, say physiotherapy or something, you don't think twice about trying to get a hold of your physiotherapist. Mental health should be treated the same. There are things that can go wrong with your mental health, but there are ways to get better, and there are ways to reduce the negative impact of mental illness on your life. For me, mental illness can stop you from living your life. And I think everybody's entitled to live their lives no matter what is going on mentally or physically. And we do live in a society where people do care. I'm not saying that the system's perfect, because it's not. But if you really try to value yourself, you will knock on all the doors you need to knock on to get the help that you need. And that's what I would encourage people to think about. Think about being in recovery rather than being in pain.
Dark place.
For me, well, I have taken an overdose of tablets on 2 occasions in my life. Once when I was only 20 years old, and once when I was a bit older than that. The only good it did was that it brought me to the attention of psychiatry, and I was referred for talking therapies and treated with antidepressants at the same time. And I learned that, way before the time when I knew I had bipolar disorder, I learned that I had a personality that was prone to depression. And every 2 or 3 years, no matter what I was doing, no matter how things were going in my life, up or down or sideways, I knew that I had to go and get some help. But it was all very manageable. I would take antidepressants for 6 months, and then my GP would tell me I didn't have to take them anymore. And then, I would do various things to try and make myself feel better, exercise, lose weight, you know, all the things that you think are really important in life. And then 2 or 3 years later, I would hit the same feelings. So there was a time when a doctor told me I had recurrent depressive disorder, which is a thing. It's a diagnosis,
Okay.
RDD. But to me, it was the most depressing diagnosis to get because I felt it was basically telling me that I was going to have to deal with depression for the rest of my life, and no matter what I did, every 2 or 3 years, it was going to become so difficult that it would stop me in my tracks, affect my relationships, affect my job, affect everything. So dark times there have been. Somehow I managed to reach out and tell people that things were not going right for me.
But when you decided to take those tablets, can you remember what was going through your head at that time?
Well,
That said to you, I'm going to do this.
I felt worthless. I felt that I had no future. The trigger was the end of a relationship. And I think everybody can relate to that. That was the first time. The second time, I was a bit older, and yet I hadn't managed to dig myself out of this dark place that I went to sometimes. And I just thought, I can't put up with this for the rest of my life. I can't put up with these feelings that I'm useless and worthless. And
this is only you telling you this. I mean, it's not someone telling you this, but for someone who's obviously now got the diagnosis bipolar, this is only your mind telling you that, though, isn't that right?
That's right.
There's no one else telling you that. But there's this belief within yourself that you're worthless, you're hopeless, you're not good enough.
That was Suzanne telling Suzanne. Mm-hmm. And, what changes is that Suzanne says, wise up, Suzanne. Wise up. Look at all the good things you've got going in your life. Why don't you concentrate on them instead of concentrating on the negative? So there's a certain amount of, you have to kick yourself up the arse to get moving. And if that means talking to psychiatrists, well, that's the way to go. But talk to your GP. Everybody can talk to their GPs. I know it's hard to get an appointment these days, but you can get through if you really push it. You can get through, and you don't have to live with that awful yawning depression in your life. That it'll swallow you up if you don't do anything about it. And I nearly got swallowed up a couple of times, and I'm just so happy that I somehow managed to avoid it.
You mentioned recovery, and you mentioned about getting better, and you mentioned cure, those three words that came up in the course of our conversation. Can you get better? Can you be cured? Or are you always on a journey of recovery, and it's just how you manage that journey? What does recovery look like?
Recovery it's a job. It's something you have to manage day in, day out. You can't afford to take your eye off the ball. You have to use the learning that you have got from, the professionals that have helped you along the way. And you have to sort of what I call do your homework. It's important to attend treatment if you get referred for treatment. Read books, go on Google it, educate yourself.
Not Dr. Google, surely. I mean, there's so much out there that can be a bit dangerous as well at the same time, can't it be? It is important to try and be directed to the right sort of information out there, and you are encouraged to know a bit more about your illness. And the Recovery College you've mentioned already is a great source for that. Actually learn a bit more about your illness and be more educated and knowledge of what even helps out there as well. But going to Google can be a bit dangerous and might be something that, do it, but limit your sort of browse history, if you want to call it that.
You're so right in saying that. You have to do it with care. And, dealing with people is much better than dealing with a computer screen. But it is important to educate yourself about your situation, and to learn different ways of treatment. So if you need to get some talking therapies along the way, particularly CBT, cognitive behavioural therapy, which I managed to get. There's always going to be a 6-month waiting list if you go through the NHS, but some people go privately. But that I've had several series of sessions of CBT with different therapists, and I always find it incredibly helpful because it makes you examine your thoughts, your feelings, and your behaviours, and the interplay between those three areas, and how you don't have to repeat the mistakes of your past. That's what it boils down to. You don't have to. You can learn other ways of living. I mean, like 20 years ago, if you'd said to me that I had to give up my career, I would have said, no way, that'll never happen. That's one thing that will never happen. And when it came to it, it took me a couple of months and I walked away. I never looked back, because what's the point of putting, like, I could have worked 80 hours a week and still felt that I wasn't doing enough. Deadlines, budgets, managing people, all those things. It was too much for me. But I didn't want to put my hand up and say that, because I felt like, oh no, people will think I'm a failure. Like, failure is part of life, and you can deal with it and you can move on. It doesn't have to be the end of your life. So that's just one of the things that I've learned for myself.
Normal life, you mentioned about living a normal life. Well, first of all, what is normal? Cheapers, who defines what normal is these days? What does normal life, if you want to call it that, look like for you now? What is recovery looking like for you now?
You have to have love in your life. And whether you get that from friends, family, partner, children, or an audience, if you have that sort of a career, you have to have love in your life.
But that also means love for yourself too, though, doesn't it?
Self-love, self-care is at the heart of all the teaching about how to recover from mental illness.
And that's something I really want to pick up on, because I know that when people talk about self-care, self-love, self-compassion, etc., I think a lot of people view that as selfish. It's not actually, because, in fact, you tell me why it's not selfish, actually. A lot of people say, oh, I can't do this for myself, or I can't do that, I'm just being selfish. Is that because that's what society over the years has said to you? And it's about changing that thought behaviour?
Being selfish can be a good thing.
Okay.
Being selfish means prioritizing yourself, loving yourself, putting the sort of time and care in to look after yourself that you would do for somebody else. You would do it for a parent, for a child, for a neighbour, for a colleague. You would help them in whatever way you could. Just apply all that to yourself. Sometimes you have to prioritise yourself, and if that comes across as being selfish, well, too bad. Maybe it is selfish, but being selfish can work. It is a survival strategy. When times are difficult and you're not sure where to turn, look inside and say to yourself, well, look, what are my values? What are the things that I hold dear in life? And put your efforts into that area. Don't waste your efforts with people and things that don't matter. Tie your efforts back into the way that you run your values in life. If you value love, you value work, that's fine. You value family, you value honesty, you value truth, and you value recovery. You can have all those things in your life, but you have to put yourself first.
And I want to pick up on a wee phrase you said earlier on in your conversation. I think it's important to try and give it a bit more context and explain it better. Sometimes all you need is kick up the backside. You use a different word than I did, but kick up the backside. But that's not kick up the backside as in chin up, chest out, get on with it. That's a case of get up, get yourself help. Really, is that what you're saying to someone, Suzanne?
There's a lot of help out there once you start to look for it. And it's amazing how well you get treated when you say, I might never have talked about this before, but I'm really concerned about my mental health for various reasons. I mean, there's also the genetic factor that, if you have a parent or a relative who has had mental illness, there's a chance that you'll be more prone to having it yourself. if you know, if you're aware of that in your life, do something about it.
Yeah, I wasn't aware until recently, to be honest with you, until I chatted to someone and they were saying that yes, mental illness now, they do believe there's a genetic link with mental illnesses. I wasn't aware of that. So, and I suppose the difficulty for some people too is that maybe 20, 30, 40 years ago, the parents, grandparents, whatever that case might be, there was no diagnosis, and mental health certainly wasn't looked at as an illness. So that could be hard for some to know, yes, there is a line here, or it's maybe identifying sometimes the traits. Yeah, I see that in my mum or my dad or my grandfather, whatever the case might be, and think, right, okay, there's a link here. But yes, you're right. It's so difficult trying to get an appointment now, and there is huge waiting lists for psychiatrists and so forth. The psychiatry, and people often wonder what's the difference between a psychiatrist and psychologist. What's your view on what the difference is? Because I know my view is psychiatrist deals with medication, psychologist goes deeper than that, and it's more about thinking and thoughts. Would you agree?
Yeah, I would agree. I mean, that's it in a nutshell. But psychiatrists, they're not just interested in medication, they're interested in effective treatment. And effective treatment is going to look something like some medication and some psychological therapies. I mentioned CBT, cognitive behavioral therapy. There are quite a few. They're under the headline of talking therapies. And anybody who works in looking after mental illness will talk about psychiatry and psychology working together. And I think that's the way you have to look at it.
And if someone walks in now to the GP and they have a chance to speak to a GP right now, and they say I have a mental health, I believe I have a mental health problem, or I believe I'm depressed, or I believe I need help. When they're asking for help, is there a way that they can ask for help, or is there a type of help, or is it a case of, listen, I need to see someone about my mental health? Is that literally the words that they need to use? Because I think, again, people don't often understand, and I get it. They don't know what help is out there. They don't know what help they should be looking for. So when they go to their GP, because I know I've learned, I'm sure you have too, Suzanne, going to any medical appointment, the best advocate you have is yourself. So being able to ask for what you believe you need is really, really important. And going in with a piece of paper sometimes about how you feel and what you think you need is okay. Going into a doctor and saying that, because that helps them direct you towards the right help. So if someone walks into the GP now, would you say it's about saying, listen, I believe I have a mental health problem, or I believe I'm ill mentally, whatever, and I need help? Is that the best way of approaching your GP, or is there a better way?
That's as good as it gets.
Okay.
And GPs can tell the difference between somebody who is genuinely concerned about their mental health and somebody who is, just, talking about the latest thing they've heard on the radio or, seen on TikTok.
Uh-huh.
Um, Nowadays people, because we value our appointments with our GPs, people don't just go because they can. It takes a couple of weeks to get an appointment, and during that time you've got time to think about how to present yourself to your GP. And if you say, similar to what you've just said, I'm concerned that I'm having mental health difficulties. I don't know what it's all about. I don't understand what's going on, but I need to talk to somebody about it.
And that's been an advocate for yourself. But if you do, if you are and do have a good family around you or friends around you, and they see a problem, can they approach a GP, or how best can a friend or a family member who sees someone and they're concerned about them, and that person maybe doesn't want to ask for help themselves, or just is not in the right frame of mind, how can someone ask for help on behalf of someone else?
Yeah, that's a great question. The way I'd approach it is, I would offer to come to the GP with the person who's
So that's allowed to happen then?
that
Yeah.
is allowed to
Right,
happen.
okay.
Yeah, that sort of moral support, practical support, that is something that GPs would regard as important.
Okay.
And they know that, if this person's friend stroke colleague stroke sibling has taken the time to come to this appointment with me, well then there must be something here that needs fixing.
But aside from that, what else can someone who cares for someone else do? to get them help?
Well,
Is there very little? And is that something that needs to change?
yeah, there is room for manoeuvre around that whole area.
Okay.
You know, getting attention on the right thing at the right time is critical, really. So no, as far as I know, GPs will welcome somebody else coming in, and there's also there are people called peer advocates.
Okay.
In the mental health system, and they are people who will come with you. Could be to a GP appointment. It could be to if there was like a mental health tribunal, if you were involved in going into hospital, if there was any sort of legal problem that you needed help with, advocates are there to walk you through the process, and literally they're your shadow for getting to make sense of those things, very much on the legal side. A peer support worker, if you happen to know one, can go with you to anything that you're comfortable with. There are, yeah, the ways of getting help are definitely improving, and having somebody on your side helping to fight your cause is really helpful.
And you mentioned hospital a few times, Suzanne. I think when a lot of people think about hospital, especially when it comes to mental health, we think white coats, wrapped up, padded rooms, etc. But it's not like that, sure it's not.
No, I mean the big Amic hospital, which is it's only been open about 7 years now.
That's in the grounds of the city hospital, isn't it?
City hospital, yeah. It took over from the previous facility, which was called Windsor House, and it was like an old Victorian grey brick building. It was not, and it was falling apart. But the staff were always fantastic. So the move was made to this new purpose-built hospital. Like every room is a single room en suite. The physical layout of the place is very modern. But it's, going to hospital is something that some people need as part of their treatment. But you really don't want to be spending a lot of time in there. If you can be treated in the community, and that, you have to sort of do what you're told if you want the privilege of being treated in the community. Hospital is the extreme end of the spectrum, but sometimes people need it.
And that home treatment team you mentioned on being treated in the community. So the home treatment team, is that something your GP can refer to, or is that something then the community health team refers to? How does that work, Suzanne?
The home treatment team can take referrals from a number of sources.
Okay.
But often from hospital, from a general hospital like A&E. If somebody has made a suicide attempt, for example, and they're in A&E, the doctor will often make a referral to home treatment team. But it can also be via a GP. If a GP sees somebody and they're very unwell, and if that GP knows about the home treatment team, they could make a referral directly. So there's different ways that people get to the home treatment team. And, if you need that kind of help, it is there.
And in your journey, were you ever sectioned?
No.
No. Now I've mentioned section. To explain, what does sectioning mean? If someone gets sectioned, what does that mean?
Sectioning is when an approved social worker, which means like a senior social worker, and a GP both agree that hospital is the only way to go for a patient, and whether or not that patient likes it. So it's an extreme measure. Often when people are very unwell, they don't have the insight to understand that they need hospital treatment. So they may be resistant, and that's where sectioning comes in.
Okay. Suzanne, thank you for coming on today with Just Mental Talk. We really, really appreciate it. But before you leave us, if you want to leave people out there with a bit of a message that if they're currently facing dark times, if they're currently they're low, as low as they possibly could be. What message would you say to them right now? If this was the Suzanne of 20 years ago, what would you say to that person right now?
There's always hope. Hope is one of the things that keeps me going, and it keeps a lot of people going. There's hope, there's help, there's recovery, there's life.
Thank you. Thank you very much.
Thank you.